Well, the UKLCC has done a lot of work on outcomes in lung cancer, and a couple of years ago we produced a report called a 25 by 25, which is an aim to get 25% people living 5 years with lung cancer by 2025. And that's quite an ambitious target and required a lot of different steps in improving lung cancer care in the UK to get to that. And we started to pull together a series of workshops. The very first one was looking at the speed of diagnosis, and we were very well aware that people were very fixed on getting between early stage and advanced stage, but we were really keen to look at the small increments in early stage. So if you move within stage 1 and stage 2, you halve your survival, long-term survival. And that period of shifting within stage 1 and 2 can be as short as a few weeks. And we know that within the NHS, those intervals quite often happen in delays. So we brought together a workshop looking at that and looking at particularly the implementation of NHS England's National Optimal Lung Cancer Pathway. And we produced a report which we've called Millimetres Matter. That means as the tumour gets fractionally bigger, your long-term survival gets worse. And I'd like to think this is a really good way. It both gives the evidence for intervening, it shows what the pathway steps should be and what the targets should be, and it also gives, I can't remember exactly how many different examples, but a lot of examples of how different hospital trusts and areas have made a big impact. One of the things that we were well aware of, which was a block in the speedy pathway and also getting people to get the best treatment, was the access to molecular pathology. So we set up a workshop with real experts in the middle of last year, and we've just published today, well tomorrow in fact as it is, a sister report called Molecules Matter. So we spent a long time thinking about how we would call these things. Anyway, so this is about access of lung cancer patients to timely and high quality molecular pathology to make sure that they get the optimal treatment to improve their outcomes. So these are two reports we'd like to think are going to influence care. Well, I think with the Millimetres Matter, we want people to look at the National Optimal Pathway to do everything they can within their own trust to implement the bits that they can, and where they can't, attempt to define where those blocks are due to issues of resource, equipment resource or people resource, and then try and push their own local authorities, funding authorities, to get those improved. But unless you actually can show that there is an actual resource block and not just an organisational block, you'll never get the resources. So that's the most important thing in examples. In terms of the molecular pathology report, we've produced 27 quite succinct recommendations dealing with things like the technical aspects of the pathology, the logistics of getting specimens sent quickly from one lab to the other, communication of results back, and things like there really is not an infrastructure there to get these things done well and quickly. There's no quality assurance program yet. We know that the quality of the biopsies that people take to send to the labs is very variable in the content and quality, so we'd like a quality improvement program in that. We'd like NHS England not only to look at the genomic aspects, which they've done quite a lot of work, but they've not really, in my view, or our view as an expert panel, really dealt with the logistics and organisational issues that which will convert that into a practical facility to make sure all lung cancer patients get the best care quickly. The UKLCC has a website, www.uklcc.co.uk. The reports and a lot of other information is there. We also, just for your interest, we ran another workshop at the end of November last year looking at early detection, so screening, public awareness and primary care issues, and I'm currently working on that report, which should be out in spring, I hope. So another one coming.